Hey everyone, Dr. Jason West, and we're going to talk about blood test alphabet soup. Because if you're like most people and you look at blood tests, you think, what the heck does this mean? Wouldn't it be nice to know what it means? So the goal of this video series is I want to walk you through and talk about blood tests, how to simplify them, what they mean, and I want to do this so that you can play a more active role in your healthcare. So the next time you look at the blood test, you'll be able to talk with your provider with more understanding and insight. So blood tests are sometimes called panels, and they're one of the doctor's most basic tools, and I believe that blood tests are the second most important part of the patient workup right after the patient history, when the patient tells you this is what's wrong, this is how I feel, this is what the triggers are. I think the next best thing is the blood tests. So it allows the doctor to see a detailed analysis of the disease markers and if they are properly trained in the deviation from optimal or developing disease. Now this is really important. Most doctors look at blood tests to say, is something really high, you have a disease, or is it really low, you have a disease. Now blood tests are a really good example to explain this is like blood sugar. If you have too high a blood sugar, you have diabetes, bad things happen, and it's a mortality factor, like you're gonna die. If your blood sugar is too low, bad things can happen, the nervous system won't get fuel, you lapse into something called neuroglycopenia, and you can die. So blood sugar needs to be right in the middle. It's like Goldilocks and the Three Bears. You don't want it to be too hot, you don't want it to be too cold. It's the same way with all blood tests. Ideally, you want the perfect range, and you don't want to start heading towards this way or heading towards that way. And many times in traditional allopathic medicine, I feel that they wait too long. Now we can see at high levels, you can see in low levels, and when it determines the physiology of your organs like your liver or your kidneys, we can look at those blood tests to determine if you have the disease, but we can also show that you might be getting the disease. And that's where the beauty of working with someone that knows how to look at blood tests from a functional medicine perspective. We want to ward off before it happens. We want to make sure that you're having this right interaction with you and your healthcare provider, and bringing your blood tests or evaluating them is one of the things that we love to do in your office so that we know where you are on the spectrum of health. And we want to make sure that we're not just in the disease categories, but if there's any deviation from optimal blood chemistry, and we want to help you to get back on track as soon as possible. Don't wait for his disease. Let's do it before the disease starts. Now, one kind of easy hack or speed up process is if you look at the range for a specific thing, and I'm going to pick sodium. Okay, sodium is really important mineral. If it's too high, it can be kidney problems. If it's too low, it can be nerve problems. But ideal sodium levels should be about 141. The range is about 137 to 147. And so if you start getting into the 130s, it's too low. If you start getting up above 145, it's too high. Like this is just one example. Most of the time when you look at the range, if you're right in the middle of the range, that's exactly where you want it to be. Now, we're going to take this series and we're literally going to start going through sodium, chloride, potassium, calcium, creatinine, glomerular filtration rate, your pH levels, albumin, alkaline phosphatase. Just stay with me, and if you're looking for a level, just to look through our videos, we can talk about different blood chemistry things. Also, if you'd like more information, we have a virtual program, we have an in-office program. My goal is to reach, teach, and heal the world by serving the patient in front of me and helping as many people to be as healthy as possible. And you can find all that information at americashealer.com. I'm Dr. Jason West, and I'll see you on the next video.